Good day to the listening and viewing public. My name is Stacey Carmichael, and this is Progress Report. Today I'm joined by the Minister of Health, the Honorable Dr. Frank Anthony. Minister, it's always a pleasure having you on the program. How are you today?
Oh, I'm doing well.
Well, today we want to discuss a number of areas as it relates to the development of the health sector in Guyana. Before we go into the meat of the matter, my first question, briefly, from August, when the administration took office to now, how has been the implementation of the ministry's work program?
Well, before we get into that, just let me say thank you very much for having me on this program.
You're welcome.
And giving me an opportunity to talk a little bit more broadly about the health sector. When we got in August, I guess our key priority and the priority for the entire government and people, for that matter, was to have a more focused COVID response. And immediately we set to work on that. So we started doing a number of things. We started reorganizing the response in many ways. We looked at a new task force that was more flexible, dynamic, had all the key people there, technical people as well as the persons who have to make decisions. And having reorganized the response, we then set about to look at aspects of the response that we need to improve. So our immediate challenge was to make sure that people got tested. We had to build the capacity to be able to do that. So you would recall that prior to us, we were doing probably about 21 PCR tests per day, and that was not enough. So there was always a backlog. And not only that was not enough, we did not have enough test kits that were in the country. So we had to quickly turn that around, and I'm happy to report that we started out with doing 96 PCR, maybe in an 8-hour period, to now ramping that up to about 450 to 600 tests per day. And then we took that even further, so our capacity now is close to maybe about 1,000 to 1,500 tests per day with the kinds of equipment that we now have at the National Public Health Reference Lab. So as it pertains to PCR testing, we have been able to build a tremendous capacity in terms of doing these tests and turning them around very quickly. We also have moved from PCR testing by introducing antigen testing. So this test, it's a rapid test, and we're able to find the virus as well. It is not as accurate as PCR testing, but nevertheless, in certain circumstances, it works pretty well. So we have been trying to get these kits for a while now. We have succeeded in getting more than 50,000 of these kits into Guyana, and we will be rolling out those types of rapid tests as of this week. So one of the things that we'll be using it for is to ensure that people who come to the hospital would have to spend some time in the transition ward. Previously, they had to wait maybe a 24-hour period. Now we can reduce that waiting time to about 20 to 30 minutes. So that has made a tremendous difference. Also, we're using these tests and deploying them into the hinterland community. So again, when you did a test, say in Region 9, you had to take off the swab, wait until a plane gets into Region 9, then send that sample out, then the lab would process it, and then when you get the result, you send that back in. That sometimes takes 3-4 days, longer, because when we came in, that turnaround time was more like 7 to 8 days. So with these types of antigen tests, it would literally take 20 to 30 minutes. Right there in the region, you get the result, you were able to, tell the patient, explain to them whether they're positive or not. So the antigen test that we're using now is going to be a game changer, and I think we'll be able to quickly identify people who need that type of testing. In addition to improving testing, we had focused a lot of our attention in building hospital capacity as well. Because again, you would know that a lot of our hospitals did not have the capacity to be able to manage COVID-19 patients. A lot of these patients, when they start getting signs and symptoms, the first set of signs and symptoms that we start seeing, apart from the fever and the headaches and so forth, would be respiratory symptoms where they can easily go from being relatively normal to having severe breathing problems. And if you don't have ventilators and other types of breathing apparatus around, those patients can deteriorate to the point where they can die. And we had a challenge when we just got in because we probably had about 3 or 4 working ventilators at our main ICU, and some of those ventilators were not even the right type because they're 2 broad types, those that you use to transport patients and those that can be used more on a continuous basis. So we needed more of the latter rather than the former, and the ones that they were using in the ICU was really those that are generally used for the transport of patients. So we had to change that. We were able to bring in ventilators. We brought in about 40 ventilators or more.
Yes, so Minister, could we talk a little bit about the ventilators and how you've improved capacity as it relates to that? Because I think we were discussing there were 3 when you got into office. Now, how many do we have and how useful are those for treating COVID patients?
Well, right now we have more than 40 ventilators. And what we have done, we have created an ICU at the Georgetown Hospital. And we have now just finished an ICU at the Ocean View Hospital. So in that ICU, we have about 25 beds, so it's much larger, more spacious. And of course, we have all the equipment and monitors to go at the patient's bedside. But in addition to building capacity at the central level, which is in Georgetown, what we have done, we have also started looking at the regions. And in every regional hospital, we have set aside beds, and we have also given them equipment such as ventilators and oxygen concentrators, so that they, if they have a patient that is, having severe forms of COVID, that they can also get treatment at that level. And I think so far it has worked. But in addition to giving equipment and so forth, we have done training for our staff. We have standardized the treatment protocols. We have a committee that is constantly working on updating these protocols. So whatever is the latest protocol in the US or in the UK, we try to update ours to make sure that it's relevant and stay that way.
Thank you very much, Minister. Now, as we're on COVID-19, another question. In terms of Guyana's COVID-19 response, how is funding coming along?
Well, we've had, the principal source of our funding has been the government of Guyana, and we've had adequate resources being allocated through the budget. So we have used those funds to ensure that we have enough PPEs, reagents, testing kits, buying ventilators, and so forth. But in addition to those funds, we've had some generous bilateral arrangements. And through those bilateral arrangements, we have seen some funds come to Guyana. So this includes the government of Qatar, who is assisting us with procuring a field hospital. And sometime early next year, we're expecting to have that hospital. In addition to Qatar, we have had from the government of India $1 million that were given to us. And with that money, we were able to buy ventilators and oxygen concentrators and so forth. We have had funding from the government of Japan, and we have identified some other pieces of equipment that we like to have with those fundings, but that is still an ongoing process. And we have had from the US, Canada, and so forth, various forms of assistance. And this has all helped us to move our COVID response forward. In addition to that, we have been talking to the banks, and we have, when we came in, we started engaging the Inter-American Development Bank, and we have been able to negotiate a 22 million US dollars funding with the Inter-American Development Bank, and those fundings are going to help us again in financing some of the COVID response. In addition to the IDB, we have also worked very closely with the World Bank, and we have just concluded all the arrangements for a loan, which would be 7.5 million US dollars. Again, that would be used in our COVID response. So in terms of financing, we have done a lot of work in mobilizing resources and ensuring that we have enough money to get the things that we need for this COVID response.
Thank you, Minister. Before we discuss the wider program as it relates to non-communicable diseases, what is the link between NCDs and COVID-19?
Well, the challenge that we're having with COVID-19, we're seeing it, anybody can get infected, first of all. But we are seeing the presentation of COVID-19 more in older patients, more in persons that would have what is called comorbidities or other illnesses. So these persons who are older and have these comorbidities are at higher risk of COVID-19, and if they get infected, we find in a lot of cases that these persons would get a more severe form of COVID-19, meaning that they tend to be hospitalized. Some of them might end up in the ICU, and some of them really, because of how severe it is, they sometimes don't make it. Unfortunately, since this pandemic has started in Guyana, we have had about 153 deaths. And if people don't abide by the guidelines, then we can expect those deaths to grow. Hospitalization can increase as well if people don't abide by the guidelines. But we have been working at this, and so when we talk about COVID-19 and other conditions, because people might have had these underlying conditions like diabetes, like cardiovascular diseases, like kidney diseases, asthma, and other respiratory diseases. If you have them and you now get COVID, you get a more severe form. In a lot of instances, you get a more severe form of COVID. And that's why people who have these underlying conditions, they have to be very careful, and they should at all costs try to avoid environments where they can get infected. So that's important, and that is the linkage between these two diseases, the severity that you can have the COVID, and also, I mean, when you go into the science of it, you will see a lot of other things that can happen in terms of heart diseases and so with COVID. And every day we are learning new things. Right now there's, in the literature we are seeing something called long COVID, where people who have been infected with COVID tend to, even after they are non-infectious, they tend to have signs and symptoms of COVID that can last for months. In other cases, we have seen persons, younger people, who have had milder form of this disease, and they got better. They're moving around, they're non-infectious, but then 2 to 3 months after, they start having problems with their heart and other organs. And again, when they make the connection, it would have been because they've had COVID in the past. So as I said, there's still many things that we are learning about COVID, and persons with both non-communicable diseases and infectious diseases, when you combine these things, can make um, getting infected with COVID much more riskier.
Thank you, Minister. And before we come off NCDs, could you give us an update on the wider program to address these chronic non-communicable diseases, please?
Well, the ministry has a department that deals with non-communicable diseases. And what we are trying to do is to build on that and to ensure that we can cover some of these things in a more comprehensive way. So in the larger scheme of things in the ministry, we had also started to work on a vision for the ministry, a strategic plan for the ministry that would go from 2020 up to 2030. And under this new strategic plan, we have just completed a draft and the directors are going through it. Under this new draft plan, we have identified priority areas that we want to work in. So, for example, on the disease control, we have infectious disease, we have non-communicable diseases, and on the non-communicable diseases, we have been prioritizing things like the cancers. We have been looking at cardiovascular diseases. We are looking at kidney diseases. And so by focusing on some of these bigger items, and diabetes, of course, by focusing on some of these bigger items, diseases that affect quite a lot of people, and once we can control them and put in preventative measures, we'll ultimately see a reduction in the prevalence of these diseases. So in terms of heart, for example, or cardiovascular diseases, we have been collaborating with PAHO, and just last week we had a meeting, and they have a methodology called HEART, which is a preventative program. These programs are geared to prevent cardiovascular diseases. And so by early next year, we want to introduce this preventative program to Guyana, but we are laying the foundations for that right now, trying to get up the team, make sure that we have all the persons who understand the methodology, and then we'll roll that out across our system. It's really it would focus more on primary health care, but if we do the things that are recommended by the program, such as reduction of salt intake, reduction of trans fats, and so forth, it would make a huge impact on persons getting cardiovascular diseases. So this is one area that we're working on.
Okay, Minister. Now, before we come off of that, cardiovascular diseases, is this the same thing, or is this a different program? I know that there's supposed to be a collaboration between the Ministry of Health and I think PAHO WHO, HEART. The name of the program is HEART. Is this the same program?
It is the same program, so it's a preventative program, and we'll integrate that into our primary care network. So we have HEART being one of the programs that we are putting in place. In terms of diabetes, we also want to look at a more comprehensive diabetic program. And one of the concepts that we are looking at is to create diabetic centers. So when you come here, if you're a diabetic patient, you will get a comprehensive package of service. So not only would you be able to get testing there, you'll have somebody who can counsel you on nutrition, because how you eat is very important. You will also, if there's a need, you can do your eye tests right at that center. If there's a need, you'll be able to do foot care at the center. And also we're looking at the possibility of offering prosthesis if that's necessary. So when you come to centers like these, you'll be able to get comprehensive diabetic care at these places. But these are things that are in the works to make sure that people get better quality of care for the illnesses that they have. So we're working on that. In terms of uh, other non-communicable diseases. The cancers are another big group that we have been looking at. And again, you will see us roll out a more comprehensive cancer care program. We want to look at the preventative and also other measures once somebody gets cancer, what we can do. Our focus in this area, we are going to be looking at, for women, cervical and breast cancer, and for men, we want to focus a lot on prostate cancer. And the reason why for women we are looking at breast cancer and cervical cancer, breast cancer is the #1 cancer in women, and cervical cancer is the #2 cancer. With cervical cancer, we can prevent it. There is a vaccine that is available if given to young women between the ages of 9 and 14. Once they take the vaccines, it would prevent them from getting cervical cancer. Unfortunately, we have introduced this program a couple of years, but we haven't seen a huge uptake in the vaccination. So this is something that we'll have to come back to, because around the world this has proven to work. And we can prevent cervical cancer, we can actually eliminate cervical cancer if we get more young people vaccinated between the ages of 9 and 14. So this is something that over the years we'll be rolling out and making sure that we accompany that with the relevant education so that people can understand the importance of doing this. Breast cancer is another focus area, and here again we'll have to pay more attention to diagnosing breast cancer earlier. And of course, if persons do get breast cancer, to make sure that we have all the necessary measures in place. Prostate cancer is the #1 cancer in men, and that too we'll have to look at. We have had some very fruitful discussions with a number of partners, and we are going to build out a robust cancer program, which includes an updated cancer registry, and to make sure that we have more specialists trained in these areas. So cancer is another one of those areas that we'll be focusing a lot of our attention on. We have also paid attention to mental health. There's a lot more that we can do in mental health. And again, you will see us roll out a number of new programs relating to mental health. We want at the primary care level for doctors to be more alert and be able to diagnose or identify mental health issues earlier. And then how do you follow that up through the different levels of care. So here again, prevention. And then if we have to go to treatment, then obviously we must put those things in place. So again, we'll be building out a number of strategies dealing with mental health. And this is not only going to be in Georgetown, but it has to be decentralized to the different parts of the country. And we must be able to offer quality service at that level. So mental health is another big focus for us. But all of that is captured in this strategic plan that I'm telling you about, which goes from 2020 to 2030.
Thank you very much, Minister. What about the program for filaria and also malaria going into 2021? I understand you have something also planned for those two.
Yeah. So that's now moving from non-communicable to the infectious diseases. And we have had in the past some bothersome infectious diseases. So, the ones that are more popular, so to speak, would be things like malaria. A lot of people might have an encounter with malaria. So we have to deal with malaria. We want to deal with filaria. HIV is still here, so we still have to work on that. So these are like 3 of the big ones that we'll be focusing on. There'll be others that we're working on, but these we'll pay a lot of attention to. Filaria, we are hoping that by next year, we can eliminate filaria from Guyana. So if we are successful at doing this, that means Guyana would be declared filaria free. For us to do that, however, we have to ensure that when we start next year, February, what is called a mass drug administration, there are some medicines that will be coming around and offering to people. We have to ensure that people drink these medicines, and once we meet a certain level in the population, then we can declare that we have eliminated filaria. This is all going to be certified by WHO and some other partners that we are working with. So we are very hopeful. You have to do two treatment protocols, so to speak. So we had one that was done last year across the country, and then you now have to do the second one, which we are planning to do in February. So once we complete these two exercises and we meet at least about 70% of our population, then we'll be able to declare, to get that declaration of being filaria free. That's going to be a big thing, because eliminating a disease from a country takes a lot of effort, and it requires literally thousands of people working together to make that happen. So I am very optimistic that everybody would collaborate and cooperate with us to make sure that we get rid of this disease. And if people don't understand what is filaria, just think about somebody with a big foot. Because I'm sure that in your community you might have seen one or two persons with a big foot, and that is really filaria. So we can prevent that disease from ever happening to anybody in Guyana once they take these medications. So that's our plan for filaria, to eliminate it from Guyana in 2021, and everybody can help us to do that. The next disease that we are working very hard to reduce is an old foe, and that is malaria. One way that we can effectively prevent malaria is, if we are going into an endemic area of malaria, that you can use prophylaxis. A lot of people don't, but these prophylaxis are available to people. And so in that way, if you drink those tablets before, when you get in, even if you get the mosquito bites, you would not get malaria. But aside from that, another very effective way for communities living in areas with malaria is to ensure that you have a bed net that is impregnated with insecticides. And these nets have become popular because when the mosquito light on the net, then they would be able to come in contact with the insecticide, and they'll die. So we have been using this type of technology for a little while now, and the ministry has just acquired 100,000 bed nets, and we'll be rolling this program out starting from this month and rolling it over into January, and hopefully we'll see a reduction in the cases of malaria by using this technology. We also have some partners that we've been working with, both from the University of Harvard, and we'll be conducting some special studies looking at malaria transmission, the dynamics of this disease and so forth. And by learning more about transmission patterns in Guyana, we'll be able to be more effective at how we eliminate malaria, or how we try to reduce malaria in Guyana. We're also going to be starting with another partner, the University of Oxford, some other techniques that we want to use in the Rupununi as it relates to malaria elimination. So right now we are in discussion with those partners on that new technique that we want to use there. So again, by leveraging new knowledge about the disease, leveraging new technology on the disease, and in some cases old ones as well, but making sure that people have access to it, can help with the reduction of the cases of malaria in our country. And that's something that we have been doing a lot of work on. When it comes to the other infectious disease that has gained our attention, again, this is one that everybody knows, HIV. And so we have placed a lot of emphasis on HIV as well. The UN has set some targets for 2020, and that is they wanted us to achieve 90 and 90 and 90 by 2020. But unfortunately, we were only able to achieve the first 90, meaning people knowing their status. The second one, which deals with putting people on treatment, we're still a little bit way off, and that we'll have to work to improve in the next coming years. We currently have about 8,000 or so persons who, who are HIV positive, and while we put most of these persons on treatment, we have to get all of them on treatment. And then it's not just about having them on treatment, it's to ensure that the treatment that they're receiving is effective so that they can remain virally suppressed. If we achieve viral suppression, it means although these persons are infected, they would not be able to transmit the virus. And therefore, this is very important as a preventative tool as well. So we have to work on this. We have to improve the way that we have been dealing with HIV and AIDS. And there are ways in which, targeted ways in which we are going to do that improvement. In another maybe week or so, we are going to release a special plan, strategic plan that we have for HIV and AIDS that is going to be going from this year until 2025. And this plan, this strategic plan, would serve as our roadmap for the next 5 years. Apart from getting people virally suppressed, those who are HIV positive, we also want to prevent new infections from happening. And we'll be doing a lot of work with persons who are at risk. And one of the things that we want to introduce is to ensure that they have what is called comprehensive PrEP. That is pre-exposure prophylaxis. Because if you use the medication, before sexual contact, and you use it as prescribed, in some cases 1 tablet every day, then you can prevent infections from occurring. So this is something that we want to roll out. It has been proven to be very effective in other countries, and we can prevent infections from happening here in Guyana as well. So we'll pay a lot of attention to this over the next couple of months, and we'll roll out a comprehensive program sometime next year. So here is another example of the kinds of work that we've been doing with the infectious diseases. Of course, there are other infectious diseases that we are working on as well, but these are the 3 main highlights.
Thank you so much, Minister. Of course, we know that maternal health is a very important aspect of the ministry's work program. So I can't complete the program without us talking a little bit about that. What are some of the plans in train for the development, offering better services?
Well, there are a number of things that we're doing. So one, we're training more people, getting them engaged, getting them to understand the risks that mothers would face. We had done quite a few studies also to understand some of the challenges. And we have tried to now use the information that we have to design better systems. Apart from all of that, we are also going to be doing new birthing homes. So, for example, we have started the construction of a birthing home in Lethem. That is scheduled to be completed either later in this month or early in the new year. So that facility, mothers who are from outlying villages can come to Lethem, they can stay there and then give birth to the child safely. We have also been building these types of birthing homes across the country. We have just completed one in Region 6. And again, we are in the process of equipping that to make sure that it has all the facilities so women can go there and give, safe birth. We'll be doing one on the East Coast. So again, another birthing home. So we have been looking at strategic areas where we can place these birthing homes so that it's closer to women who need these services, and we are ensuring that we put persons to man these places where with the requisite skills and so forth, equipment and things like that. And all of that, we believe, would help to create a much safer environment for the pregnant woman. In addition, we've had challenges when women get pregnant, um, they, they have anemia. And in some studies that were done previously, it has shown that women who were anemic and did not receive proper nutrition before and during their pregnancy can have babies with lower birth weight, and that can be a challenge for that child as the child develops and grows. Now, again, because of the kinds of studies that we've done before, we've been able to identify a number of factors, and we want to work with women even before they get pregnant to ensure that they have safe pregnancy and they're able to get all the right nutrition and so forth. So these are other programs that we're rolling out. We have also been using Region 9 as a pilot region for rolling out of a medical information system dealing specifically with mother and child. And so that you will see more of that happening early in the new year. The system is pretty much designed. And we would be giving to almost every health center in Region 9 a package of equipment to ensure that antenatal clinics and so are properly equipped, and when the women give birth, to make sure that they have proper postnatal follow-up and so forth. So we have lots of things in train, and so while our priority has been on COVID, we're still working in many of the other areas, and working as aggressively to make sure that we, rein in some of these other diseases as well.
Thank you so much, Minister. Another area, permit me to ask you, smart hospitals. We have, I think, it's 5 of those. So just give us a little update on that.
So that's a project that we have been doing with the UK. And apart from the 5 hospitals that we have actually started to retrofit, we have also done studies for about 80-something facilities. And these studies basically went in, they assessed the facilities and came up with a plan, what would it take to make them into smart facilities. So we have done that assessment, and in the future, as we move forward to renew the capital infrastructure that we have, we will be guided by some of the findings of these studies that were done through the SMART initiative. But coming back to the 5 that we are actually working on and retrofitting, the first one is a Diamond, and most of the internal work and so for that hospital has been completed. We are hoping that at least the building, the hospital building, would be handed over to us sometime in this month, but they will still have to continue doing some work in the yard. And the reason why we are calling them smart facilities is because we want to make these facilities more climate resilient, meaning they must not be flooded. And we also want to utilize solar power so that we can use the power of the sun to generate electricity. We have put in a large battery bank at Diamond to ensure that a lot of the outlets that they have there would be powered by solar power. We are catching our rainwater that when it comes off the roof. We can utilize that for doing things in the facilities as well. So there are a number of initiatives, and of course we have retrofitted it in such a way to make sure that you have a smoother flow within the hospital itself. And I think when we reopen Diamond, people living and utilizing the services up there would be pleasantly surprised by the amount of changes that we have done at Diamond. We have now started Lenora, and that is going to continue for another couple of months, the whole retrofitting. And again, similar principles are being followed. We have also started doing work at Mabaruma and Lethem, and again, similar principles. We haven't started as yet, but we are expected to start shortly at Paramakatoy, so that would complete the 5 facility. So in a nutshell, I mean, for a short period of time, just a few months, we have basically completed and bring into operation the Ocean View facility. We are retrofitting Diamond, completing that. We are doing Lenora, Mabaruma, Lethem, and Paramakatoy. We are completing a maternity home at Lethem. We are going to start building one on the East Coast. We are going to bring it into operation, the maternity home at New Amsterdam. And in addition to all of this, we have already moved the process forward with the government of India to allow for funding for 3 hospitals, or to fund substantially these 3 hospitals, which would include West Demerara Hospital, where we probably invest about $6 million US dollars, Suddy Hospital, another $6 million US dollars, and the Bartica Hospital. So all of this, we have, advanced the process. We have spoken to them. We have moved the negotiations forward. I think by now they have identified the contractors who would be working on these projects. So things are moving. Things are moving.
Yes, yes. So, Minister, you've said a lot, and we've discussed a lot of areas as it relates to the development of the health sector in Guyana. Before we wrap up the program, could you give us a little snapshot of 2021? What can we expect next year from the ministry, and specifically the COVID-19 vaccine? How will we implement that?
Well, I think we all are optimistic for 2021 that we'll see the back of COVID, meaning that we'll be able to get an effective vaccine and that we can immunize a large part of our population. So we're working on that. COVAX, through the COVAX mechanism, we're going to get vaccines for 20% of our population. And we have been looking at other options to make sure that we can get enough vaccines to meet herd immunity. So next year, one of the big tasks is really to roll out that vaccine and to immunize people. Outside of that, we want to eliminate filaria. So that's another program that we'll be working on. We'll start the construction of these 3 hospitals. And we also want to bring in some other partners to look at other types of infrastructure that we have and to improve them. We are going to complete the 4 other facilities that we've started: Lenora, Mabaruma, Lethem, and Paramakatoy. So those would be completed and people would have access to them. HIV, we are going to roll out PrEP. So these are things that people can expect. Next year, we want to reduce the amount of shortages of drugs that we have in the system. This has been something that has been going on for far too long. And while we are right now trying to buy emergency supplies and try to make sure that we have adequate supplies, by next year we want to stabilize this and make sure that all the essential medicines that people need, they'll be able to get it. So when they come to one of our health facilities, they'll be able to get that. So we have a lot of work to do, and we're pushing, but next year is going to be another exciting year for health. And we're building a strong team. We're bringing in a lot of people with expertise to make sure that we can deliver on many of the things that we have promised in the PPP's manifesto, to ensure that people can have a better quality of life and a longer, healthier life. That's what we want to ensure.
Thank you very much, Minister. Now, let me just thank you for joining us today on Progress Report, and I hope to see you again on a follow-up program because I'm sure there are other areas we would like to touch on. So thanks again, and thank you to the listening and viewing public. I'm Stacey Carmichael. Today I was joined by the Minister of Health, the Honorable Dr. Frank Anthony. This has been Progress Report. Goodbye for now.